Prime Minister Dr. The Right Honourable Keith Mitchell says the 2022 budget must focus on critical policies and programs to get the country through this COVID-19 era. We'll have details to this story and more in the National Report. With the details to the news for Friday, October 1st, I am Rikisha St. Louis. Prime Minister Dr. The Right Honourable Keith Mitchell says the 2022 estimates of revenue and expenditure must be centered on critical policies, projects and programs for the next year. He was speaking at the opening of the virtual budget consultation on Thursday. The consultation seeks to come up with strategic priorities, and Dr. Mitchell pointed out that health and wellness is high on the priority list. He underscored the significance of investing in the health sector, especially now that COVID-19 is taking a toll on the well-being of citizens.
The traditional approach to budgeting cannot be the same approach, simply because we are dealing with a number of uncertainties. We are dealing also with some factors that we never had to confront before. The emphasis on health is something that cannot be, it's something that we must realize as individual citizens, as a country as a whole. That must be always at the top of everything we do. Because what is happening, as this virus has shown us, the healthier we are, is the more the capacity for dealing with this virus, for physically going through if one gets infected, relies heavily on the health of the body.
Finance Minister Honourable Gregory Bowen said the only way Grenada can rise above the harsh effects of the pandemic is through balancing the immediate needs of the people, protecting lives and livelihoods. Minister Bowen said government intends to get the economy back on track in the shortest possible time.
We are at a crucial juncture where we must relook, rethink, and even re-engineer our healthcare system to adequately meet the mounting needs of our people, especially during a crisis such as this. Investing for growth and resilience. We need to look at the policies, projects, and programs with the greatest potential in this period that will drive economic growth, foster economic transformation, and build resilience. This will require focused attention and investment in several key areas, including agriculture, health and wellness, youth and education, renewable energy, resilient infrastructure, manufacturing, tourism, and digital transformation.
COVID-19 has caused disruptions in economic activities that led to a lower than budgeted revenue collection in 2020. Expenditure needs were high with additional COVID-related spending. In 2021, revenue collections remained below pre-COVID levels and expenditure needs have grown significantly. The Ministry of Health continues to record a decline in positive confirmed COVID-19 cases following weeks of steady increases during the months of August and September. Health officials are pleased with the decline in recent days as results from clinics held island-wide returned daily with positive figures below 100. The latest dashboard on September 30th revealed there were 55 new positive cases with 386 recoveries and a cumulative recovery number of 3,803. Acting Director of Medical Services at the General Hospital, Dr. Taisha Donald, said although the science shows that there are periods of spikes and declines, she warned against complacency, which can see a quick return to positive figures above 100. On Thursday, during a press conference held by the Ministry of Health, Dr. Donald reiterated the importance of maintaining discipline and adhering to the COVID-19 protocols.
There are different reasons for the decline. One, that the disease is taking its course. Two, that there's an increased amount of persons vaccinated within our population, and that also helps in terms of curbing that spread. And generally speaking, you have the natural course of the disease. So you have that graph where you have a spike and then you have a decline. So we're now in the decline phase where the disease in terms of spread has taken its course, and we're going to now have a decline. Of course, that is also dependent on us following those 4 measures that Dr. Noah spoke about. The wearing of the mask, sanitizing, making sure we get vaccinated, and maintaining social distance. So, of course, if we don't maintain what we call the behavioral changes, that decline can change. So it's very important that we adhere to these changes.
Dr. Donald made an appeal to parents of children 12 years and older with underlying conditions to give serious consideration to the Pfizer vaccine. Vaccination, she says, is still our only sure shot of surviving the impacts of the virus.
I'm a pediatrician by profession, and I just want to encourage persons who have children 12 years and over that they can also be vaccinated, particularly the children with sickle cell disease, children with asthma, children with diabetes. These children are also high-risk children, but children in general is a high-risk group. But more so, the ones 12 years and over with underlying conditions, I want to encourage you to get vaccinated. Vaccination is still our best shot in helping to boost immunity against the COVID-19 virus. So get vaxxed.
Continuing the news, Minister for Education Honorable Emmeline Pearce says the Education Act and the T.A. Marisho Community College Act are both now under review. A special committee has been appointed to consult with all relevant stakeholders and submit a preliminary report to the Minister by December 31st, 2021. The Education Minister, who previously gave the commitment that the process will commence in September, is pleased that this is now moving forward. Former Education Minister Ambassador Clarice Charles has been appointed chair of the TAMCC Review Committee, and Mrs. Gertrude Niles, retired education official, will head the Education Act Review Committee. Both committees will include officials from the Ministry of Legal Affairs. This is the National Report. The news will continue after the break.
Let's get tough on breed larceny. It will destroy our economy. Larceny threatens our food security. Can hurt us locally, hurt us globally. To all the buyers, ask for license from all produce sellers. To all the people, call 300 for police for them thieving fellas. To all the farmers, please don't steal produce from your brother. Then you sell it to traffickers, hotels and street vendors. Nah, man. Let's do all we can to stop breed larceny. New vigilance, new laws, and a tough judiciary. Stop Grenada's organized business crime. It's time.
To report breed larceny, call 300.
Welcome back. U.S.-based infectious disease physician Dr. Molara Alexis says Grenadians living with comorbidities can take COVID-19 vaccine. Dr. Alexis, who is currently volunteering her services here, is seeking to assure those who may be hesitant to accept the vaccine because of an illness. Comorbidities put individuals at higher risk if COVID-19 is contracted. During the weekly post-cabinet briefing earlier this week, Dr. Alexis explained that the vaccine reduces any chance of contracting severe COVID-19. She also assured that the AstraZeneca and Pfizer vaccines available in Grenada can be administered to persons living with lung disease, heart disease, diabetes, hypertension, and asthma.
As medical professionals, we are saying that if you have these comorbidities, sugar, diabetes, pressure, hypertension. This is just the common way we call it. If you have chronic lung disease like asthma and emphysema, if you have heart disease, another one is sickle cell. Was common here in Grenada. These comorbidities, these illnesses put you at higher risk for getting a severe case of COVID. And it is essentially because you have these that you should be first in line to get the vaccine. So as a medical doctor, as an infectious disease physician, I am here this morning to say that diabetes and high blood pressure and these comorbidities, they are not a reason for you not to get the vaccine.
The vaccines can also be taken by persons with a weakened immune system.
People who have a weakened immune system, for example, HIV, or maybe cancer, or you're on maybe you have lupus and then you're on a high dose of steroids and methotrexate. Again, this is not a reason not to get the vaccine. Granted, you may be taking a medication that may affect your immune system, so your physician will give you the best time to take the vaccine. But even with a cancer patient, you're on chemotherapy, your doctor may advise you, okay, do it in such and such a time. But again, people with cancer, HIV, people who have autoimmune conditions, these are not reasons not to take the vaccine. We stand here as a medical community to say that.
Dr. Molara Alexis is currently on island with primary health care physician Dr. Karina David to give assistance within the health sector as the country's fight against COVID-19 continues. Both are Grenadians residing in the U.S. The Coast Guard unit of the Royal Grenada Police Force has received a supply of wet suits, shoes and face masks through an initiative of the Grenada Tourism Authority and the Ministry of Foreign Affairs through Grenada's mission in Brussels. Permanent Secretary with responsibility for Foreign Affairs, Roxy McLeish Hutchinson, made the presentation to Permanent Secretary for National Security, Kim Frederick, on Thursday.
Our mission in Brussels has been involved in resource mobilization efforts, in particularly for the RGPF. And today we are pleased to hand over to the Ministry of National Security and the RGPF some items, protective items for the officers of Coast Guard, wetsuits and boots. We have cutlery for use, as well as disposable masks. We understand the constraints that government is undergoing at this time with the increase in the COVID cases and the important work that our colleagues in national security do as frontline workers. And so today it's with a great pleasure that I present to my colleague P.S. Frederick these items which are as a result of the efforts of our ministry in Brussels, our mission in Brussels, and so that we can assist in some way in the work that is done at the national security front.
ACP John Mitchell says the donation is timely and they are extremely thankful, as with each challenge, there is an opportunity.
On behalf of the Commissioner of Police and in particular the members from the Grenada Coast Guard unit, we just want to express our deepest sense of gratitude to you from the Ministry of National Security, from the team in Brussels, also the Ministry of Foreign Affairs, and I think tourism was somehow involved in it also, with regards to the gifts that we have received. Now, certainly with every challenge, there is opportunity. And with the challenge that Coast Guard is facing now, certainly they would have used it to leverage partnership and cooperation. And I'm really excited that they would have done such. So I just want to again say that is a great opportunity that we have here now. And I think that the gifts that we have here would certainly go a tremendously long way in the operational readiness of the Coast Guard unit in terms of advancing its operational mandate of safety, response and rescue in general.
Grenada's ambassador to the Kingdom of Belgium, Her Excellency C.J. Augustin Canu, said the donation will help to protect members of the RGPF. She gave the commitment to continue to support the endeavors of the police force and government.
I am so pleased that the items sent by the Embassy of Grenada in Brussels, Kingdom of Belgium, reached the safe hands of the Royal Grenada Police Force and their Coast Guard Division members this morning. The Coast Guard team secures and keeps our waters safe for all Tri-Island nationals. So the small donation today is to ensure that safety commitment is continued. This donation is the first of 3 shipments that will be sent by the Brussels mission in due course. I'm grateful to ACP John Mitchell of the RGPF and ASP Edwards of the Coast Guard Division who received the boxes on behalf of the RGPF Commissioner. I must mention and thank again ASP Edwards and Corporal Berry of the RGPF Coast Guard for their assistance and taking my many calls and emails from overseas when needed. The fire department is next, as their items are still being negotiated by the Brussels mission.
That story just ended the national report for Friday, October 1st, recapping the top story. Prime Minister Dr. The Right Honourable Keith Mitchell says the 2022 budget must focus on critical policies and programs to get the country through this COVID-19 era. On behalf of the entire news and production team, I am Rikisha St. Louis saying thank you for joining us. Until next time.